Welcome. Today we're going to talk about the cardiovascular system, and in specific the blood vessel. If we do an overview of the topic, we separate heart, and then from heart, the blood passes through arteries, arterioles, capillaries, venules, to veins, to go back to the heart. A blood vessel has three major layers. We have the tunica adventitia or sterna, and what it has, it just has a lot of collagen in order to provide protection to the blood vessel. Then you have the tunica media, which is just smooth muscle, and what it does is a major role in vasoconstriction, vasodilation through the vasomotor nerve. And then the last one, we'll have the tunica interna or intima, and what that one is just simple squamous epithelium that provides clotting factor and smooth the ride of the blood through the vessel.
The first type of blood vessel we're going to talk about are arteries, and there's three different types of arteries. We have elastic arteries, also known as conducting arteries, and they have the most elastin and are located closest to the heart. The second type is muscular arteries, also known as distributing arteries, and they're away from the heart and they become more muscular. They're used for vasoconstriction and vasodilation. The last type is arterioles. The biggest one have three layers, but small arterioles only have the layer of muscle cell and remaining endothelium because they lose the externa. Capillaries help aid in gas, nutrients, and waste exchange. There's three main different types of capillaries, and the first one's going to be continuous. Continuous capillaries are the most common ones. They have tight junctions, intercellular clefts, which allow fluid to move in and out, pinocytotic vessels, which help absorb H2O, and they also form the blood-brain barrier with tight junctions. The next type of capillary are fenestrated. They have fenestrations, which act as windows to help exchange, and their location is in small intestines, kidney, and endocrine organs. The third type of capillary is sinusoidal. They have more fenestrations and larger clefts. Their location is in bone marrow, lymphoid tissue, and spleen. Next topic is capillary beds. Capillary beds contain vascular shunts, which connect arterioles and venules. They connect terminal arterioles to metarterioles to thoroughfare channel all the way to the postcapillary venule. Here they have true capillaries, where gas nutrients exchanges, and then we have precapillary sphincters, which wrap at the true capillaries to allow or stop blood flow.
The Venom System, and in specific the venules, they collect blood from the capillary beds using a specific structure called postcapillary venules. These postcapillary venules are made of endothelium, and they have really large pores in order to allow still some exchange of nutrients and waste. The veins, which is the structure that comes right after, collects the blood and sends it right back to the heart. As an adaptation, veins have larger lumens with thinner walls in order to allow more blood to get to the place, and they have thinner walls that allow less resistance for the blood. Also, veins have a one-way valve that what allows is the blood or helps the blood to go in one specific direction and not to come back. However, there can be also alterations of these structures. Veins can have abnormalities, and in this case we have a common one called varicose veins. Varicose veins are nothing else than just dilated veins, and they got dilated mainly because at some point the valves failed and the blood started to puddle. Also, we have hemorrhoidal veins. These ones are located in the anus, and it's pretty much like a varicose vein. As another adaptation or structure of the blood vessels, we have something called anastomosis. We have two kinds. We have arterial anastomosis and venular anastomosis. Arterial anastomosis is when one vessel joins to another in order to form an alternative pathway to supply an organ with more blood. Or maybe because there is a blockage and the body tries to bypass that blockage. And the same happens with the venule. The venule, let's say that the body is trying to get rid of blood from a specific location, there is a blockage that impedes it, then what it forms is just an alternative pathway to release that blood and send it straight back to the heart.
Blood flow, blood pressure, and resistance. Blood flow is measured by millimeters per minute. It measures through artery, organ, or body. For our entire circulatory system, it's cardiac output. Blood pressure is a force pushing against the vessels. It's better to measure blood pressure near the heart. Peripheral resistance is friction found by blood against the vessels. It's affected by blood viscosity, blood vessel diameter, and total blood vessel length.
Systemic blood pressure. In this case, we're going to talk about topics related to the distensibility of the blood vessel, and that specifically means how stretchy it is, and also for the amount of blood that is being forced into them at a specific given time. Regarding to this force, we have three main pressures that we're going to talk about. We have systolic blood pressure, diastolic blood pressure, and pulse pressure. Systolic pressure is the force that the blood has when it's leaving the heart, and it should be around 120. Diastolic pressure is the force that the blood has when coming back to the heart, and that should be around 80. And the pulse pressure is mainly the difference between systolic and diastolic. But we can also calculate the MAP, which is mean arterial pressure, and that one is calculated as diastolic pressure plus the division between pulse pressure and 3. However, we have alterations in the blood vessels that we have spoken about before. In this case, we have something called atherosclerosis that is nothing else than just the blood vessel losing the properties of stretching. Now, in order to do waste exchange, nutrients exchange, you still need pressure no matter where you are in the body. However, you need a lower grade. In this case, in the capillary beds, you don't need as much, only from 40 to 20, but it's still necessary to be able to complete the task of exchanging nutrients and waste. In the veins, the pressure, like we talked earlier, is even lower than that. That's why the veins require those properties that are going to allow the blood to be able to go back to the heart. In this case, we have the valves, we also have the respiratory pump, and the muscular pump. The valves, we already talked previously. The respiratory pump is nothing else that you breathe, that it changes gases cause a change in pressure in your core, and that aids the blood to be able to come back to the heart. And the muscular pump is nothing else than your skeletal muscle pushing or squeezing the blood back to the heart.
Maintaining blood pressure. Factors affecting blood pressure is cardiac output. Cardiac output equals the stroke volume times the heartbeat. Peripheral resistance, which is short-term control of blood pressure. Blood volume and blood pressure, which equals cardiac output with peripheral resistance. Short-term mechanisms. Vasomotor center. Control blood vessel diameter. The sympathetic neurons in the medulla oblongata also affect the short-term mechanisms of maintaining your blood pressure. Vasomotor fibers are stimulated. Most release norepinephrine, and some of the skeletal muscle release acetylcholine, and that increases vasodilation. Vasomotor activity is modified by baroreceptor input, chemoreceptor input, hypothalamus and cerebrum, hormones and other chemicals, cardiovascular center.
Baroreceptors initiated reflexes. They're located in the carotid sinuses, the aortic arc, and the elastic arteries of the neck and the thorax. The action of them is if blood pressure increases, they cause vasodilation. If the blood pressure decreases, they cause vasoconstriction, with the idea of maintaining homeostasis. We also have higher brain centers. They are included in here medulla oblongata and hypothalamus. And we also have chemical controls as a short-term mechanism, and we have in this one norepinephrine, which causes vasoconstriction. Epinephrine can cause increase in CO2 levels and therefore vasoconstriction. We also have the ANF, which is atrial natriuretic factor, that what it does is producing the atria, and what it does is decreases the blood volume and therefore the blood pressure, and is an antagonist for aldosterone. We also have the ADH, which make the kidneys reabsorb water, making the blood volume increase. And we also have angiotensin 2, which makes the blood pressure to increase thanks to reabsorption of sodium, and where the sodium goes, water follows.
Renal regulation and long-term mechanisms. First one's going to be direct effects via changing your blood volume. The kidneys control the blood pressure in long term. Indirect effects is renin-angiotensin mechanism. It decreases MAP, which then the kidneys secrete renin. Renin then is triggered, and then the production of angiotensin 2, which then causes vasoconstriction, then increases systemic blood pressure, which then stimulates the adrenal cortex to secrete aldosterone. It causes the kidneys to increase sodium resorption, water follows sodium, and that decreases your urine production and increases the blood volume. Monitoring your circulatory efficiency. You monitor this by doing vital signs: your blood pressure, your temperature, your pulse, and your respirations. Measuring blood pressure. When you measure someone's blood pressure, use a blood pressure cuff and a stethoscope to listen to the pulse. Sounds of Korsakoff during auscultation of the blood pressure is normal sounds heard. But factors that can affect your blood pressure is age, weight, sex, race, and social economic status.
Tissue perfusion and blood flow through the body and organs. The purpose of it is transportation of O2, exchange of nutrients, removal of waste, and allow gas exchange. However, this one is done through several mechanisms of control. The first one we're going to talk about is metabolic controls, and this one is done through the blood passage through organs and tissues, being the lack of oxygen the strongest stimulus to increase blood pressure. The second control would be the myogenic control, which is mainly done with the use of smooth muscle. The next one will be the long-term autoregulation, which is mainly controlled through angiogenesis. Then it comes to the brain, which this one has a really funny mechanism. It uses the pH level in order to bring more oxygen to the brain. And it explains this way. The brain allows the pH to drop, and in environments where the pH is low, it is rich also in CO2. CO2 is going to cause vasodilation, allowing more oxygen to go to the brain. In the lungs, it's a totally different story. When you have low levels of oxygen, what is going to happen? There's going to be vasoconstriction. And what that's going to do is to slow down the blood flow, allowing more time for the blood to pick up more oxygen and take it to the rest of the body.
Blood flow through capillaries. Vasomotion is slow intermittent flow through capillaries. Capillary exchanges of respiratory gases and nutrients happens either between diffusion or active transport. Diffusion goes from high concentration to low concentration, and active transport goes from low concentration to high concentration. Fluid movements. Fluid moves through hydrostatic pressures, which is pressure against the wall capillaries. Capillary hydrostatic pressure is filtration pressure, which is caused by the blood pressure, and it moves fluid out of the capillaries. Interstitial fluid hydrostatic pressure is a force exerted by tissue. It moves fluid back to the capillaries.
Circulatory shock. The definition is inadequate blood flow. It happens for several reasons. The first one we're going to talk about will be hypovolemic shock. Hypovolemic shock happens due to hemorrhage, third spacing, extreme dehydration, and the way the body tries to fight against it is to first increase the heart rate, second, vasoconstriction, and the last signs of hypovolemic shock would be the sudden blood pressure drop. The next one will be vascular shock. That one is going to be related to the pipes. And what happened is totally out of expected vasodilation. And it can happen due to two reasons. The first one could be due to an autonomic nervous system failure to maintain the vasotone. The second one could be anaphylactic. And also sometimes it can be related to bacteremia due to the bacterial endotoxins causing that vasodilation. The next one will be cardiogenic shock, which is related to the pump, and it's mainly, the heart is not able to pump the right amount of blood to keep the blood pressure up. And the last one would be orthostatic intolerance, which happens mainly in astronauts when you're exposed to environments with zero gravity for a really long period of time.